like where to even go to find that help. Because quite honestly, I think it takes a master level social worker to navigate all the county databases to say what's available to you. And that's part of the reason why we have master level social workers working on our team. But you just wait to the very end when you get to that stage of burnout where you're like, you break down. And when you break down, you're like, I have no options. My only option is to take that leave of absence, or my only option is to quit work. If I can afford to do that financially, I'm going to quit work so I can focus full time on taking care of my loved ones, right? Which obviously then you have the repercussions of financially being set back when in your own retirement savings and in what you're going to need to support your own caregiving journey.
Did you know that in 2020, there were 53 million caregivers in the United States? And by 2025, this number is expected to grow to 62.5 million. 73% of these caregivers also have a job. They are called working caregivers, and they are invisible because they don't talk about their caregiving challenges. Working Caregivers, the Invisible Employees, is a podcast that will show you how to support working caregivers. Join Selma Archer and Zack Demopoulos on the Working Caregivers, the Invisible Employees podcast as they show you how to support working caregivers.
Good morning, good afternoon, good evening from wherever you are listening to our podcast, The Working Caregivers, the Invisible Employees. We thank you for tuning in. We've got a great show today. Selma, how are you? I'm Zack Demopoulos, by the way.
And I'm Selma Archer, and I am doing fantastic here in California. Yay!
Well, is it warmed up at least for you just a little bit?
It has. It has warmed up. You know, it came out of the 30s a couple days ago. So
awesome.
It feels nice and toasty now.
Awesome. Well, we've got a super guest today. So, Selma, why don't you introduce our guest and let's get into it.
Absolutely. We have with us Dr. Madhavi Vemireddy, whom we met at Caregiver Nation a few months ago. So we are so excited to have her as our guest today. Welcome, Dr. Vemireddy.
Thank you. Thank you for having me.
Welcome. And can we say that you're our first physician on our podcast? So woohoo!
Yeah, that's amazing.
Yay.
Thanks for being here. Thank you so much for being here.
So we'll get started. Well, basically, we'd like to just give you a warm-up question, and that is, tell us a little bit about the area that you're from.
Yes. Well, I am in the Bay Area. I live in the Bay Area now, so halfway between San Francisco and San Jose. It's actually where my side of the family lives. I have two younger sisters and my parents, all within a 40-minute drive of where I am. I moved here only 5 years ago, and prior to that, I was in New York City. And lived in New York City for over 20 years. My husband is born and raised New Yorker. And so I essentially wanted to move back to California to be closer to family, especially with my two boys. And now I get to see, my parents more often than what I did when I was living in New York City. So
wonderful.
That's the best part of living here for me.
That's wonderful. I can share that because I am married to a born and raised New Yorker as well.
Yes.
It can get challenging.
How that is, Selma.
Yeah, it can get a little challenging, right?
Hey, easy. I live in New Jersey, folks. That's close enough. It's getting a little close here. Let's move on.
Yes. That's a whole different podcast.
Yeah. So let's get started, as Zack says. Maybe you could share with us just a little bit about your personal care experience, who you care for, and what maybe are some of the challenges that you encounter as a working caregiver.
Yes. So I have two boys. I have a 14-year-old and a 10-year-old. And my eldest was born prematurely and was diagnosed with congenital heart disease at birth. And so I usually say I've been an active caregiver for him since, the day he was born. And the first year of his life, first 9 months, we were struggling. He wasn't gaining weight. He missed all his developmental milestones, essentially had failure to thrive, and no one could figure out why. And it was really Jeff and I, my husband Jeff and I, trying to find the right experts, get a diagnosis, and realize that he needed open heart surgery at 9 months. Thankfully, and he was, only weighed 9 pounds at 9 months. So he was a tiny little boy. And thankfully, the surgery fixed the heart problem and allowed him to start gaining weight and start meeting his developmental milestones. He was sitting up at 15 months. He was walking at 2 years. And so we thought we were on the path of catching him up, but he wasn't talking. And so at age 5, we did a neuropsychiatric evaluation. And that's when we were told that he was on the autism spectrum and that he needed to be in an ABA-based school setting. Both Jeff and I were like, what are we talking about here? We just went through this whole, traumatic journey with him. And now you're telling us there's something else happening.
Right.
And this is not really, because we just felt like it was related to what he had been through. And so at age 14, he is minimally speaking. He still has significant motor delays. We still are working on his communication and, sensory regulation. And it's challenging. It's challenging to have a 14-year-old child who can't express his needs, and he feels that frustration, and he's going through puberty now. And so there's a lot of changes that are happening within him. And, it's been hard for us because we are, really trying to put together the best plan for him, right? The best set of therapies. And, our goal is to get him to independence. And we're trying to figure out, how do we get him there? And so right now, my current fight, us fellow caregivers, we're all warriors.
Yes.
So constantly advocating for our loved ones. So my current fight is, next year or later this year, he goes to high school, and they're not going to put the special needs program is not planning to put him in a diploma track because he's minimally speaking, and they feel that he really should be in an independent living track. And so we're fighting that because I know that he's intelligent. I know that he comprehends everything. It is an issue with expression, and it's an issue with motor planning. And, my perspective is, it is, the system's job, the educational system's job, to help him get a diploma, to help him go to college. And that is our goal for him. So, it's hard navigating all of that while you're working full time, right? It's not a simple, set of tasks, and you don't even know what to expect, in the next few months, right? And what new things could appear. And so that's where, like, when the journey is constantly evolving and things are progressing, might be in a good way or a bad way, you just feel like you're on this roller coaster while you're working full time, right? And taking care of your other child and yourself. And so that's where the day-to-day challenges come in, right? Because I've got this very fine balance, and any one thing happens, I can get tipped over. Last summer, my dad ended up in the emergency room because he got really dizzy, couldn't walk. They thought he was having a stroke. And I had to, leave everything, drive, 45 minutes to go see him, and was going back and forth for over a couple of weeks. And I just felt it, like that impact on my physical health, on my emotional health. And so, luckily we got him home and he's independent now, but I know it's like a matter of time, right? Where he's going to need more support.
Well, thank you so much for sharing that. And you're not alone. We have heard parents talk about similar experiences with children that are special needs and navigating the school systems particularly. So just continue your journey and continue your fight.
Dr. Vemireddy, I'm just sitting here just in awe, as well as just emotionally, just I don't know how to describe it. Just when you were talking about a 9-month-old having open heart surgery
Yeah.
is enough for anyone to handle. And then on top of that, what you're dealing with now that he's 14 is incredible. I don't even think you are a sandwich generation. You're actually a double club sandwich, I guess,
Yeah.
with all
Yes.
the needs that you're going through. And
Yes.
so
I feel like a panini at times.
a
Many
panini.
times.
Oh my goodness, without a
Panini, oh
doubt.
my God, smashed.
Yeah, yeah. So,
Yes.
thank you also. Selma said, thank you for sharing that story, for being vulnerable and sharing that with us. We really appreciate it. We do talk about, when we say caregiving, we talk about children with special needs. We talk about older adults. We talk about spouses and siblings. In fact, I just want to mention to our listeners and viewers that our newsletter on January 14th had Mike George as the real working caregiver. And he tells a story about Ben, Dr. Vemireddy. If you haven't read his story, you should. His son
Yeah.
doesn't speak a word. And he
Yeah.
went through college using technology, which is
Yeah.
absolutely incredible. So we will have prayers and hope that you'll get what you can through the school system. I got a feeling you're going to get it. So hopefully
Yeah.
it'll come through.
Yes.
But I would like to just change gears for a second. Selma and I did meet you at the Great National Alliance for Caregiving Summit, which again, readers and listeners, you can learn more about that in our newsletter on December 3rd. We had a large section of our newsletter talking about that, and we got a chance to meet you there. It was an amazing conference. It was Selma and I's first time. Can you tell us a little bit about why you chose to be there? And then also, what were your takeaways from it?
Yeah, no, great question. So Cleo is part of the National Alliance of Caregiving members, part of their membership. So right now I participate in their Cancer Care Collaborative workshops, really looking at how do we support family caregivers of a cancer patient in our healthcare system today, because that's a gap, right? We really are focused on supporting the patient with the best treatment plan, but we don't think about the caregiver and what their needs are, during that journey. And having, both my husband and my sister diagnosed with cancer in the last, I'd say, probably 10 years, like this is near and dear to my heart as well, where I've had to be a caregiver supporting them during their journey. So part of the National Caregiver Summit, the first day was a workshop meeting for the Cancer Care Collaborative that I participated in. But then I was also asked to speak at the summit, really talking about technology and how technology can be used to support family caregivers, really across commercial and Medicare payers. And so really highlighting the work that we're doing at Cleo, to provide that coaching support, that care navigation support across various complex care journeys. Because obviously you shouldn't be going through the caregiving journey alone, right? And there's so much need to have access to the right experts, but also to the right digital support, because there's information we could be providing to you in real time based on the needs that you have, right? And so how do we really build out technology to support these needs across these different care journeys? And I love the mission of NAC. I actually had Jason Resendez present to our customer advisory board, talking about their mission, talking about the caregiving landscape and what employers can do to really, drive more awareness. I mean, if you think about, Cleo's customers, especially our customers that have been with us for a number of years now, they're huge thought leaders, right? They recognized early on that their employees were in various caregiving roles, especially if they have a multi-generational workforce. They have folks going through the pregnancy journey, parenting, caregiving for an elder loved one, and many of them are going through multiple care journeys at once, and realized that they need to support these needs so that individuals can stay in the workforce, especially women, that they are not facing the burnout and emotional well-being strain from caregiving while working, And obviously there's the productivity impact, right? And improving productivity by making sure that they have the right support in place. Jason's, I would say, message was talk about it more, right? Raise the awareness on the importance of having a caregiving solution to support families across these various journeys, because it's only going to grow over time. We know our sandwich generation is going to grow with the aging population. I just love getting in a room with so many individuals across various industries
Yeah.
that are all, share the same mission of just creating a better society and better healthcare ecosystem that is aimed at better supporting family caregivers. It was an amazing event. It was my first time too. I know it's not going to be my last time, but I really loved it, and I got to hang out with Selma on Capitol Hill
Yes.
advocating for the Older
Yes.
Americans Act, which
That
was
was fantastic.
yeah, that was a great experience. Loved it.
Yes.
Yeah,
Yes.
I'm just again, listeners, viewers, please be sure to check out the newsletter where we talk about it, and also podcast episode number 9. We did have Jason Resendez as a guest, so you can learn
Yes.
more about the leadership. Thank you, Dr. Vemireddy, and thank you on behalf of all families impacted by cancer. I actually had just a shout out to Haley. I'm going to chop up her last name, but Haley, who is the founder of a company that she created called West Status. And because of the conversations that she was having with women with cancer, who are also mothers, who are also working, who are also
Yeah.
trying to deal with all kinds of things in their lives, in addition to the cancer, she
Yeah.
decided to form a company to help them with, like a concierge, to help them with insurances and things like that. So your work is certainly appreciated tremendously. But thank you. Thanks for sharing that.
Yeah, absolutely.
Yes. I know when we had that day on the Hill, you and I had a great conversation around the work that you do
Yeah.
at Cleo. And it's just so fascinating, the work that you do, because you actually work on both sides of the coin. You support working caregivers as well as employers. So for the audience, for audience's purposes, could you just express a little bit about what it is that Cleo does in those areas in terms of supporting both the working caregivers as well as their employers?
Yeah, absolutely. So Cleo, I think what's unique to Cleo is we take a population health approach to supporting families really across all life stages. So pregnancy, parenting, caregiving for an adult or older adult loved one. What does that mean? So that means we're really thinking about no matter where you are in your care journey, you could be early on. We all have parents, but are we having the conversations with our parents right now around what matters to them? Do they have their essential legal documents in place? Where are they? Or what are those early warning signs that your parents may need help, right? Are there mobility concerns? Are there concerns about dementia? Are they taking their medications? What are their medications? There's so many things that we need to be better prepared about, because unfortunately, most of the times we end up caregiving for a parent in an emergency situation. They're in the ER, and then all of a sudden all these questions start getting thrown at you, and you're not ready for it. You're not prepared, right? So there's part of it is early in the journey. We want everyone to understand about long-term care around healthy aging. But we also want to support those that are caregiving for a loved one. And that could be for very specific needs, whether that's your parent has dementia, Parkinson's, heart failure, cancer diagnosis, or you have a child with neurodivergence or a cancer diagnosis. So, we built out these evidence-based pathways that are called life paths. So we have over 40 life paths that we have developed so that we can provide that very targeted education and resources around, okay, what are the things that you need to know about for your loved one's specific care journey that they're on, so that you're empowered, right, to advocate for them so that you can help drive better health outcomes for them. The buyer is employers, so that they're offering the service to their working caregivers, their employee caregivers. but we also sell it into health plans, both on the commercial front as well as on the Medicare front. We're actually about to launch our first Medicare Advantage customer, where we are providing the service directly to the Medicare member, but we're identifying who are the caregivers taking care of them, right? And so that we can not only support the MA member directly, but we're also supporting their family in that journey. So really taking that family-centered care approach, because quite honestly, we believe services should be free for family caregivers, right? There is so much health impact here, physical health, emotional health, social isolation, that there is cost savings back to the at-risk entity, whether that is the employer or whether that is the payer. Like just how today, health plans have population health programs, because the goal is let's identify those high-risk individuals, let's deliver the right interventions, let's drive improvement in key outcomes that will then drive cost savings. Well, that same model has to be applied to family caregivers, because we have this huge population. I mean, you all know about the RAND study, and they estimate that we're at 100 million caregivers of adults who are taking care of someone that's ill or wounded or injured. And that's 40% of this country today. And we think about how the population is aging. And in the next 5 years, we're going to go up to, 77 million adults, 65 plus. So, we know caregivers, the number of caregivers are going to grow proportionately to that. And the number of sandwich generation caregivers are going to grow in the next 5 years alone. And so here you have this significant segment of our population that's not being supported by the care delivery system, that are not being supported by the health plan programs. Is a huge gap. I mean, I'm beginning to hear like specific programs that are being built, maybe in specific areas like cancer, where they're doing some emotional well-being support for the cancer caregivers, but it's not at scale. It's not where it needs to be. And this is what we're trying to change with respect to our ecosystem. And, obviously, where we see significant value. For example, I think one of the biggest challenges we have today is that caregiving is hidden, right? Many people don't share it with their managers because that's like raising your hand and saying, hey, I'm distracted. I have a lot going on, right? I may need to miss days of work or leaving early, or while I'm at work, I have to research various resources for my loved one. And so it's hidden from that perspective. There's a lack of awareness that what you're doing is even caregiving. So that's also a big area of education and awareness that we help drive. And then you don't see it on the claim line. The health plans don't see it as a top cost driver. Your employer doesn't see it as a top cost driver. So what they see it as, oh, this is a nice to have. This is a value to our employees. But what they don't see is like, oh, this is actually costing us a lot of money. Because if it showed up on a claim line like cancer, musculoskeletal, mental health, guess what? You'd have more employers putting in programs to say, oh, we need a solution to help mitigate that cost. And today, because it's all hidden, the productivity cost is hidden, the healthcare cost is hidden. You don't even know how many people in your workforce are actually in these caregiving journeys. It's all hidden. This is the problem we have. And so we're trying to raise that awareness to say, well, let's use that. Actually, stepping back, this is the primary reason why Cleo launched the Family Health Index. Because we said we need to bring more analytics so that we can identify the various risks that families have, so that we can go back to the employer and share in aggregate. Oh, you have over a third of your families at higher risk for burnout. Last year alone, we found 60% of our families that took the Family Health Index fail a PHQ-4. That means they have early symptoms of depression, anxiety. And if you don't address the root cause of that mental health strain, they're going to go on to develop a diagnosis, right? In addition to leaving the workforce. What I love is the study that Blue Cross Blue Shield Association did in 2020, where they looked at their database They found 7 million caregivers, close to 7 million caregivers, and they identified caregivers as someone is taking care of a dependent, found that they had 26% worse health outcomes, much higher rate of hypertension, much higher rate of depression, tobacco use compared to benchmarks. There's huge health risk here that no one is seeing.
There's so much to unpack there that we would need about 5 podcasts. Can we just clone you 50 times and send you to every state and talk to all the municipalities about this? That's incredible.
Yeah.
Kudos to you for what you're doing with the Medicare Advantage program and also identifying caregivers through the care recipient. That's brilliant. I love that. I think that's what we need to do more. You're using the word hidden. Selma and I like the word invisible. It means the same thing, but I love it. I love it. But Dr. Vemireddy, and I think I saw this in one of your LinkedIn posts, and I really recommend everyone listening and viewing to follow Dr. Vemireddy. She has some really amazing posts, not those typical billboard motivational pitches, that she really gives you some good content. Not that there's anything wrong with those, but one of your posts I remember reading, and you made such a valid point that employers sometimes don't know a thing about the caregiver status of their employee until maybe they ask for a leave of absence or start asking questions about paid time off. And you kind of already hinted towards a little bit of that, but can you share a little more as to why you think that is, and what can an invisible or hidden employee do more so that their employer can be on the lookout for their needs?
Yes. I think the biggest challenge the other challenge, we have a lot of challenges here that we just talked about, but I think we've got a lot of opportunities also to solve for these challenges. But one of the challenges we have, and I've seen it quite honestly, even in my own personal journey, is that when you're caregiving for a loved one, especially when it's a multi-year journey and you are working full time, guess what happens? You put yourself last on your to-do list, right? And because you're powering through, you're doing what you need to do for work, you're thinking about your children, your spouse, your other family members that you take care of, and what that day, that week, what needs to get coordinated, done. And the only reason, like for me, the way I make sure that I prioritize my self-care is by signing up for a race. I sign up for half marathons every 3 months, because then I'm like, oh, all of a sudden that starts bubbling up higher on my to-do list. Oh, I got to train for that race. And so I exercise, and that allows me to find time to exercise, which significantly helps with my emotional well-being, because I see what happens when I don't. You start getting, sad, and you're like, oh my God, completely overwhelmed. And you feel that sense of burnout of like, I can't do it all. Right. And so this is the challenge where caregivers they don't know that help exists, and they don't, and in some places, like where to even go to find that help. Because quite honestly, I think it takes a master level social worker to navigate all the county databases to say what's available to you. And that's part of the reason why we have master level social workers working on our team. But you just wait to the very end when you get to that stage of burnout where you're like, you break down. And when you break down, you're like, I have no options. My only option is to take that leave of absence, or my only option is to quit work. If I can afford to do that financially, I'm going to quit work so I can focus full time on taking care of my loved ones, right? Which obviously then you have the repercussions of financially being set back when in your own retirement savings and in your own, what you're going to need to support your own caregiving journey. But so that's the problem. I think it's primarily, especially if your leadership is not talking about it, then it's like taboo. I mean, just think about like the journey we've gone through over the years, like mental health. Like you wouldn't talk about mental health in workplace. Now we do. We weren't talking about menopause in the workplace. Now in some places we are, right? And same thing. We're not talking about caregiving in the workplace and how this is a universal journey. I mean, I love Rosalind Carter's quote, and I know you know it well, right? It's like everyone's going to go through this. If you haven't gone through it, it's
We
coming.
will.
Be
Yes.
prepared. It's coming. So I feel like that's the biggest challenge. People are not comfortable talking about it because it has to start from the top. You have to have your leaders being vulnerable, talking about the challenges of caregiving while working, talking about the programs that they have put in place, the benefits they have put in place so that they're not going through these journeys alone, right? Because then it's like, oh, now I can talk about it. Now I can share that with my manager. Now my manager knows, oh, there is actually programs that we have, benefits that we have that can support you. So the manager is now armed with the toolkit of like, here's what, how we can help, right? Flexible work arrangements, paid leave of absence, other support systems. And so I think that's why we're seeing that significant increase in mental health leave of absence that's happening over the last, couple of years. It's because of this burnout, significant burnout.
Yeah.
That's
And,
happening.
and to be fair, and I've been on both sides of the coin. I've been a manager and I've been in HR. We do need to
Yeah,
prepare our managers. We can't just put them out there and say, hey, have these conversations. We do need to prepare them. So
Absolutely. So I know when we met, we had all day to chat, about caregiving and about legal, from my perspective and how they came together. And one of the questions that sticks in my mind that I asked you that day was, so why did you leave the traditional practice of medicine and go into this caregiving space? And why do you continue with that? And what gives you joy about this work? And I loved
yes.
your response. So can you just share?
So I completed my residency, and after I completed my residency, I was recruited into, at that time, digital health. It was before digital health was really a coined term, right? But I was brought in to essentially build out evidence-based analytics to help drive better care for patients, right? And help patients advocate for themselves. The company was founded by a cardiologist, Lonnie Reisman. So it always had that strong clinical foundation of just understanding like the healthcare system today, right? And this is probably still true in many respects, but like, physicians only had access to the data within their four walls. You learn the most of, medicine during your training. And then once you leave training, it's up to you to stay up to date with the latest evidence-based care. And so we were seeing a significant amount of, gaps in care that were happening because of that. And so basically I stayed with that company for 18 years because I loved the mission. We were helping to drive better care for patients and really arming physicians with information about their patients that they didn't have access to. It is because of my caregiving journey that I took my population health lens that I, essentially have been working on for those 18 years and said, wait a second, we're not touching the caregiver. I'm the caregiver here. Nobody's reaching out to me to ask how I am doing. Nobody did, right? It took my first session with my Cleo guide, quite honestly, when I joined the company. When I told her my story, she said, oh my gosh, you went through a very traumatic experience. How are you doing? No,
Wow.
my OB didn't ask me that when I had my second child. My, PCP didn't ask me that question. I didn't have a health plan reaching out to me to say, how are you? No. And so I was lucky though in my journey in that I had managers that were empathetic. They knew what we had gone through. They knew, I was with this company for 18 years. So do whatever you need. We're here for you. And that gave me the confidence to stay in the workforce. Because at one point, I almost said, I actually had a new CEO come in. I had reported into the CEO. It was like day 2. And this was literally 1 week before my eldest Zavi was going to have his open heart surgery. And he comes in as the new CEO. And, my job is to tell him everything that's going on about the company and give him deep dives and all of our capabilities and our outcomes. And my first conversation with him was that I don't know if I'm going to come back. This is what happened with my son. I don't know what's going to happen after the open heart surgery. If it goes well, then yes, I'll my plan would be to come back. But if it doesn't go well, then I will not come back. And it was a hard conversation. It was my first conversation with my new boss. But I just had to lay it out there to say, I don't know what's happening right now, right? And my family is my number one priority. And you know what? He got teary-eyed. And he said, you do whatever you need to do. You take whatever time you need to take. So I've been blessed to have bosses where I could have this conversation with and who have been empathetic and compassionate and have allowed me to have my caregiving moments, right? And figure out how I balance that with work. And so it's a long-winded answer to your question, Salma, but it is my experience being a caregiver combined with the professional experience of building analytics and population health programs, and then seeing that gap from my own personal experience with the healthcare system and saying, we've got to go fix that. And we have the tools, we have the framework. They just haven't been applied to this population. And that's what we are set out to do. And that's my mission. That's my mission for the rest of my career, is to fix this problem.
So we should mention here that not only did you come back, but you are now the CEO of Cleo.
That's
so
right.
Bravo.
That's right.
That's an excellent journey that you've had. Bravo to you.
Thank you so much for sharing that. That's awesome.
I feel like we could do this
all day.
All day.
Oh,
yeah.
For coffee.
Oh.
Absolutely. I still have more questions, but we'll save them for another time.
We can plan a part 2. I am definitely
absolutely. That would be absolutely. That would be great. Meanwhile, how can employers find you if they're in search of, support from an organization like Cleo?
You can go to Cleo. We're at highcleo.com. There's ways to connect with our team. Obviously, you can connect with me on LinkedIn. I'm happy to have conversations with anyone that's interested in wanting to, drive meaningful improvement and impact to their caregivers, whether it's on the payer side or on the employer side. I think we need to come at it at all angles to fix this problem.
Absolutely.
100%.
Well, thank you. Thank you so much for joining us today. We have had such a great time listening to your wonderful insights and your experience. And being a caregiver, as you've said throughout the conversation, makes a total difference. The journey that you've had as a caregiver, because you're on the inside, working from the inside out. So that makes a total difference.
Oh my
so
goodness.
Thank you for accepting our invitation.
Yeah. Of course. Thank you for having me.
Thank you, Dr. Vemireddy. Thank you so much. And you know what, I'm going to do another challenge. You know how I like to do that. So some of our listeners out there, we have employers, HR, managers, leaders. Here's my challenge, or our challenge to you. Who will be the first person to have a no obligation conversation with Dr. Vemireddy? I mean, like Selma just said, you're not going to find someone who can handle all the 4 negative impacts of caregiving: physical, physician, you got emotional, mental, and financial. Challenge to who will be the first person to reach out. Just have a conversation with Dr. Vemireddy on how maybe you as an employer can do a little bit more to support your working caregivers. Thank you so much, Dr. Vemireddy. It's been awesome.
Thank you.
Thank you for tuning in. Be sure to catch new episodes of Working Caregivers, the Invisible Employees podcast, every other Tuesday. Please also visit our website, invisibleemployeeadvocates.com, to subscribe to our newsletter, purchase our book, and learn more about how we can help you strengthen your workplace to become more supportive of working caregivers.